before the worlds began, you were always there. You are Alpha and Omega, beginning and the end.
Hello and welcome to the LivingWell broadcast. My name is Dr. Levonne Samon. I'm a primary care physician and I'm also board certified in internal medicine. My goal with the broadcast is to provide a way for you to send in questions that you may have regarding your medical care. It's not easy sometimes to get the answers that you need. Sometimes we're not even sure what's the right question to ask. So I'm hoping that this broadcast will help give you information that's helpful, that will help guide you along the journey towards better health. In 3 John verse 2, it says, "Dear friend, I hope that all is well with you, and that you are as healthy in body as you are strong in spirit." God wants us to be healthy in our bodies, our soul, and our spirit. And my goal is to guide you by giving some answers to questions that you may have so that you can make a better decision about your health. There's nothing like getting a good understanding of what's going on. So send in your questions and I'll do my best to answer them. So welcome and let's get into today's broadcast. Today, I would like to spend a few moments giving you some tips on how to get the best results from your visit with your doctor. I know that you've probably noticed that doctors have limited time to see patients, and in order for you to get the most out of your visit with your doctor or medical provider, whether it's a nurse practitioner or a physician assistant, it does take a little bit of preparation on your part. And you want to be able to communicate with your doctor the needs that you have in the time frame that is assigned to you. Before every visit, you should write a list of your concerns. As I've said before, doctors, many of them are on a time crunch, and most of them have to get you in and out of the exam room within a 20-minute time span, if not less. You want to get the most out of that visit, so you need to use that time well. By creating a list, when your doctor asks you what your concerns are, you have it ready for them. And I would suggest that you say something like, "I have 3 concerns. I've been having headaches, I'm having nausea, and my foot hurts." Just give them the big picture, 1, 2, 3. And then from there, the doctor then can go into further details on each of those complaints. Now, every doctor works differently, but I'm just giving you some suggestions that may work to help you get your problems addressed in the time frame that you have. If you have more than 3 concerns, it's probably best to show the list to the doctor, with your 10 problems. And the doctor can then look at that list and say, okay, let's work on these 2 problems today, because I think these are the most important ones. And sometimes what they think is the most important one may not match what you think is the most important one, but they're looking at it in the order of which would cause most harm to not address today. So keep that in mind. And then you can then address some of those other concerns at a follow-up visit if it's not urgent. So what are the benefits of making a list? One is it helps you not to forget to mention something that you wanted to discuss. I've done that. I've gone to the doctor and my main concern was this. And after our discussion about problem A, B, or C, I get back out to the parking lot and say, oh my goodness, I forgot to tell them this. So making a list helps you not to forget to mention something that you wanted to discuss. Secondly, it helps the doctor to focus on the top priorities, as I said before. I can't tell you the number of times where I have been in a room with a patient. They've told me everything that's going on with them. I've done my exam. I have come up with a treatment plan. And as I'm leaving the room with my hand on the door, they say, "Oh, by the way, doctor, I've been having chest pain." Now, a chest pain complaint is not a simple complaint. And so I then have to either reschedule the patient or try to address it quickly. And something that is as important as chest pain requires more time. So making the list helps you not to forget. Making the list helps you and the doctor prioritize what is most important to be addressed today. If you throw out, now let me go back a bit. There are people that they speak very quickly, and they may throw out 10 problems to the doctor in 20 seconds. Some of those things may not be heard, and as a result, they may not be addressed. So sometimes what you have to say is overwhelming to the doctor because you've given them a flood of words that includes the medical problems. But you also, before you got into that, you talked about the fight that you had at home with your son before you left the house, the traffic that you had to deal with on the way to the appointment, how the car broke down and the dog died last week. And by the time you get to the medical problems, we're not even sure what you came in for. So it would be great if you have a wonderful relationship with your doctor and you can mention things like that, but try to focus on the main issues up front. And then if time permits, you can let them know about all the other things that are going on in your life if there is time. So keep in mind that your time is allotted for, as I said, at the most, probably 20 minutes. And that includes from the time the nurse calls you from the waiting room area, does your vitals, and puts you in the exam room, and the doctor does everything they have to do and gets you back out to the lobby. That's 20 minutes. So that leaves maybe about 10 to 15 minutes at the most where you are one-on-one with the doctor. So keep that in mind. There are also times where patients are frustrated that they had to wait so long, but then when it's their turn, they take up as much time as they could possibly take up and don't realize that there's a line of patients waiting to be seen, and they're getting impatient just like you were impatient before you were seen. So be considerate of the other patients that the doctor has to see. Get your plan of what you want to speak to the doctor about in place so that you can have an effective visit. The next thing I want to talk about is having a list of your medications, or actually bringing the bottles of medications in. And these include vitamins and herbal supplements and things like that. My personal preference is for the patients to bring the bottles in because that is the most accurate way of knowing what you are taking. There are patients that have a list, but sometimes the list has not been updated and it's from 2 years ago. So many things have happened in that time frame where you've been to other specialists and they've changed medications, or you went to the hospital and when you were discharged, they stopped something and started something else. So it's best to bring in the medications so that we have an accurate list of what you're taking. There are times where we have a list that says you are taking these medications and you tell us that yes, you are. And then when you finally do bring the medications in, we realize that you've been missing one of those medications for several months. I've seen that several times where the blood pressure that used to be well controlled is now not well controlled. And when we finally solve the mystery, it's because a medication has been dropped. Maybe you forgot to pick up the refills, or you ran out of refills and forgot to request the doctor's office to send in more refills. So things like that do happen. And it's best to keep your doctor aware of what you're taking and bring your medications in. Thirdly, in line with that, I do want you to be honest with your provider about whether or not you are taking the medications. There are times where some medications may cause a side effect that's unpleasant, and you may decide that I'm not taking that anymore. That's fine, but you do need to inform your provider that you are not taking that medication. Sometimes patients are afraid or ashamed to tell their doctor that they've stopped taking the medication. And by not being honest with the doctor, you actually end up hurting yourself. So, say, for example, you've been prescribed a blood pressure medication and you stopped it for one reason or another. You had a side effect that you did not like. You read something online or something on the package insert that was concerning to you that could be a potential side effect. A friend told you of something that happened when they took it. There are multiple reasons. If you do not tell the doctor that you're not taking it and they think that you are taking it and your blood pressure is still very high, their plan will probably be to increase the dose or add another medication to what you're already taking or think you're taking. And sometimes patients end up with more medications than they should be on because they were not honest enough to tell the doctor what's really going on. Now, there are some patients that require multiple medications, so don't take that to mean that you're not supposed to take all of those. On another broadcast, I will be dealing with high blood pressure and how it needs to be treated. So be honest with the doctor. Let them know that you're taking it or not taking it. And if you're not taking it, why you're not taking it. Our goal, or it shouldn't be, my goal is not for a patient to suffer from a side effect. My goal is that you would feel well while we're prescribing, while you are taking the medication that is supposed to help you. The point. If you are seeing a doctor for the first time, it's important to inform them if you've had an allergic reaction to any medications in the past. There are many times where you change doctors or you go to the emergency room or a hospital, and for some reason you might not remember medications you're allergic to, and that can cause a problem. So I know that many now do have electronic records and they can pull up things that has happened in your care in the past, but not all offices are equipped that way. I would suggest that you write down your allergies on a little piece of paper and keep it in your wallet. Or if you are, savvy with technology, you can put it on your phone so that you can have that information handy to give to the doctor and try to remember experienced. Was it a rash? Was it hives? Was it, swelling of the face and lips, which is more severe, or shortness of breath? So keep a list of your allergies and make sure you inform your doctors of this list. Before I go further, I do need to address this because I believe that there are some of you that are listening today that you can't even really hear what I am saying because you are in a place where you cannot feel comfortable with trusting the medical providers. We are in a totally different environment now than we were just a few years ago. With the events that have happened in the past 3 years since COVID and the political and social upheavals, many people have become more skeptical of the medical profession and have become their own doctors. I see it every day. And it's not hard to understand why this has happened. We're in an age now where we have a lot of information at our fingertips, and many feel that they can do their own research and do their own treatment because they do not trust the medical system. For some people, that's been okay, but I can give examples of people that have actually had worsened health outcomes and died prematurely because of not utilizing the medical system and not getting proper care. Sometimes we use our faith to not take action, and we'll speak boldly and loudly about trusting God, and I know He's going to take care of me, and I don't need the doctors to take care of me, and I don't need medication. But I ask that you pray about that, because sometimes we're responding because of fear. We're responding that way because we're afraid. And we're using those words to mask what we really feel inside. And I ask that you pray about your medical visit before you go to the doctor. I ask that you pray for God to guide the decisions of your medical provider. And I ask that you pray that your mind and heart will hear what you need to hear to make the right choices. I know that it's hard to do, especially if you have experienced something or heard something that caused you to not trust your doctor. And not every doctor is the same. So if you can find a doctor that you trust, that's a great start. But if you don't know them and you have to see them, you pray, because God is in control of everyone, and you can hear what needs to be, what they want to say, and then you can pray about the information that you've received and get good counsel as to what you need to do. Ask God to help you make the decisions that are based on trust in God, which is what faith is, and not because you're afraid of the unknown. I'm not just speaking as a doctor. I myself have been a patient more than I would like to be. And there were decisions that I had to make. And some of them were very scary. And there were some that I felt like God was telling me not to do it. And then when I paused and calmed down, I realized that it was fear that was talking and it was not God. And so I had to go forward with what was being recommended for me to do and trust Him. And I thank God for healing me. And so healing can come miraculously. Someone can lay hands on us and God can take away whatever it is that is ailing us. And sometimes it's a process, and sometimes He uses man-made devices and He uses people to help to get us to a place of health. We use man-made devices every day to help our lives better, to be better. We use microwaves. We ride in cars. We drive in cars. We get on buses. We get on airplanes. And those are man-made devices that help our lives be better. In the same way, God has given doctors and scientists skills that may help you have a better quality of life. We're not saying that our dependence is in man, but it is in God. But our faith does not prevent us from utilizing and accessing these things, as well as the medical care that can help us be better. You know, when Jesus was here on earth, He walked on water, but He also used a boat to get to the other side more times than He walked on water. And while He was on the boat, a storm did come up, but He had power over the storm. Sometimes our journey to health is not a quick, miraculous healing. Sometimes it requires us to use a boat. And by that I mean doctor's visits, medications, surgery. But these means of healing helps to get us to the other side, which is health and wellness. There may be a storm that may rise up as we're on our boat, but remember, our God reigns over the storms and will bring you safely to the other side. So be of good courage today. The Lord is on your side. These are just some general tips that may help your visit go more smoothly and in the long run will benefit you. I hope that I have said something today that you can ponder and think about. If you are getting medical care and you have additional questions about the treatment plan, again, I am not here to say whether or not your treatment plan is the right one, but I do want to help answer any medical questions that you may have. And if you have been avoiding going to the doctor because of your lack of trust, just know that God is able to use men and women to help us get to a place of better health. And in the meantime, do what you know to do to remain healthy. We will be addressing things like that in future broadcasts, but you want to do your part to stay healthy, and you want to go and get your checkup. Maybe nothing is wrong, but once you get to a certain age, I would say by the age of at least 30, 35, if not before that, you should start seeing a doctor to make sure that you're well. There are things that you may not know is going on, and if you catch it early, you can make the changes that are needed to put you on the road to better health. So get your checkups. Women, get your mammograms and your pap smears. If you're past the age of those things, then there's still things that you need to see the doctor about. At the age of 50, you need your first colonoscopy. So these are things we don't want to do. So many of us are afraid of medicines. We're afraid of doctors. But it's time now to step out of fear and into faith. And faith requires action on our part. It's not just saying the word of God and saying what we believe, but it's action. And you will be able to do the action if you have the information that you need to know what you need to do. So I thank you for listening to this broadcast today. I hope that you've heard something that will cause you to reevaluate where you are or continue the journey that you're on if you're on the right path. Please send in your questions, and until then, be blessed. You have been listening to the Living Well broadcast with Dr. Levonne Samon. I hope you have been blessed, informed, and empowered to live well. Remember, God will always be faithful to His word, but we must do our part so we don't work against our own health by the choices that we make. Let us ask God for wisdom and understanding. And whatever decision you have to make concerning your medical care, I pray that it will be aligned to His will and will bring you to a place of health and wholeness in Jesus' name. Any information that you've heard on today's broadcast is not by any means intended to diagnose or treat any medical condition that you may be dealing with. You should always discuss your concerns with your medical provider so that he or she can properly evaluate and treat you. I look forward to our next time together. Until then, the Lord bless you and keep you. The Lord make His face shine upon you and be gracious unto you. The Lord turn His face toward you and give you peace. And remember to live well.
Is everything you've made, the birds that sing, the flowers